Everyone. My name is Keith Grant. I'm the Senior System Director for Hartford Healthcare's Infection Prevention Program. We're going to start this morning, as we've always done, just by commending and recognizing our healthcare heroes, our healthcare staff, in this unprecedented event, obviously, the pandemic. There's so much that we've done. And again, I want to also focus on the efforts that's been put forward by the community to ensure that we're now at a place that we're, reopening and discussing about transitioning and ensuring that we're more available to the community. So again, I just want to keep a lot of focus on our community and the efforts that's been put forward as well. I'm going to go over some numbers from Hartford Healthcare as a system, and focusing on our COVID positive and our PUIs at this time. So the total number in Hartford Healthcare system at this time is 188 COVID positive patients. There are 308 PUIs, so these are patients that are being investigated, potentially having the disease process. And how that breaks down from an acute care setting is Bacchus Hospital with 2 positive patients and 29 PUIs. Charlotte Hungerford right now has no positive patient but has 66 PUIs. So there are 66 patients that they're reviewing at this time. Hartford Hospital with 28 COVID positive patients. Imagine that. So 3 weeks ago, imagine the 28 as a number at Hartford Hospital. So significant progress. And with 132 PUIs. And that large number of PUIs have a lot to do with, obviously, increasing screening. And for Mid-State Medical Center, there's 8 positive patients and 25 PUIs. For St. Vincent Medical Center, there's 19 positive patients, and at this time they're seeing 10 PUIs. For HOCC, 7 positive patients with 27 PUIs. Wyndham Hospital, there's 4 positive patients with 7 PUIs. So total for the acute care setting, there's 68 positive patients and 296 PUIs at this time. Behavioral Health Network with 1 positive patient. They've been seeing 1 positive patient at this time, no PUIs. Community Health Network with 119 and 12, so 119 patients, 12 PUIs. 119 patient represents patients that's transitioned through the continuum of care, transition out to their homes, and is now getting care from that extension or that arm of the Hartford Healthcare community. So that's a good number. For visitor restriction policy, obviously there's a lot we've changed over the last few months. One of the things that we've changed is how to, one of the initiatives we implemented to ensure safety for our community is put some visitor restrictions in place. So as we pivot and move forward, we want to extend our capability and include visitors coming back into the healthcare system. So that's something, there's a safe, phased approach that we're implementing, we're expanding, and we'll continue to expand our visitor policy or a visitor restriction policy to include more community members coming in to see their loved ones. So it's a good thing. And from what there's a few questions that's been coming out, and I know we'll take questions after this, but I'll just preface by saying, update on COVID, how we're doing. So how we did with COVID, how we're doing now, and what we're expecting. I think as a health system, as a community, when you look at mortality numbers, it's hard to ever say we've done well with mortality numbers, but relatively, it's we've done pretty well. And for what we learned is you can never be too prepared with this process. We've had a lot of challenges, but the thing that I've spoken about before on this platform is how much we've come together, the community, as a healthcare system, as not just Hartford healthcare system, but healthcare systems within Connecticut, as how we've accepted the responsibility as a healthcare system to ensure that the appropriate information is available for everyone. We've accepted the responsibility to ensure that the magnitude or the number of testing that is needed keeps increasing, and now not just the number of testing, but the access to test we've definitely worked on improving as well. Going forward, what to expect from Hartford Healthcare and our commitment. I think our commitment is unwavering. We will continue to increase our capacity and our capability. We will continue to serve this community, providing world-class healthcare to this community. We will continue to be on the forefront of any change in treatment protocols. We will continue to ensure that we're providing the highest level of PPE, not just for staff or for colleagues, but also for visitors who are coming in. We will continue to ensure that the appropriate information is going out to the public, and that's a commitment from this exceptional team with Tina and Rebecca, that Tina and Rebecca puts together. So at this time, I want to introduce Dr. Tishler. Dr. Tishler is the director for the Metabolic and Bariatric Surgery Department. Highly regarded, Dr. Tishler. All you.
Thank you, Keith. Good morning. Appreciate the opportunity to speak with all of you today. I want to give you an update on where we stand in our program, but it's also representative of a lot of the different programs we have at Hartford Healthcare. So for our Metabolic and Bariatric Surgery program, we made a change several months ago, as many people did, and we had to switch a lot of our visits to a virtual visit. At first, I, like many physicians, especially as a surgeon, I felt that it wasn't something that was going to be doable, but we adapted to it, and we've embraced it. And it's really led us into a new stage of how we deliver care. And I think one of the benefits that we've seen is that we've offered care to patients who otherwise would have had trouble getting to us. And I think it was an unintentional effect that we saw of this. We just want to provide care to all of our patients as easily as possible. But then we realized that we were getting into people's homes that otherwise had trouble with, say, with transportation or with mobility. And we made it very easy for those patients to be able to see us virtually. Now, I don't think virtual visits will ever replace that face-to-face and touching that we love to have, that bond we have with our patients. But it's really enabled us to get a glimpse into people's homes. When I see patients in my office, I don't see their families in the background. I don't see their homes. I don't see their living with grandparents and other relatives. And being able to have that glimpse into people's homes has been very eye-opening to me. We deal with the disease of obesity, and obesity definitely affects some of our more underserved populations to a greater degree. And it's been a big eye-opener for all of us when we've seen how the COVID-19 pandemic has disproportionately affected our Black and our Hispanic populations. And that's something that we've been working on with obesity, knowing that obesity also disproportionately affects these populations. And the glimpse into people's homes, living situations, seeing into a multi-generational home, things that may be a little different than what we normally see when we're working with someone face-to-face has been extremely eye-opening. The other thing we've been able to do is we've been able to engage our patients throughout the entire 3-month period of this COVID pandemic. And we've done it through our social media presence. We established a Facebook support group for our patients. Now, support is so important when it comes to weight loss. Support groups are a key cornerstone of our programs. And it was something that we used to do on a regular basis, but it was once a month, once every other week. And now we're able to do it continuously. The support group has well over 500 members now, and what we're seeing is that patients are engaging with each other all through the day. A patient has a question, someone else answers it, and the answer may come at 2 in the morning. And it's gotten to a good critical mass, and I think this is going to be some of the support we offer in the future. And I can see this applying across the spectrum of care that we offer at Hartford Healthcare for a variety of disease states. So I think the COVID-19 pandemic has really accelerated us into a new realm of technology and how we're able to offer care to our patients. As far as patient care is concerned, we're back doing elective surgery in a very thoughtful and responsible manner. I'm very proud to tell my patients that I feel probably more comfortable coming into Hartford Hospital or any of our Hartford Healthcare facilities probably than I do going to a lot of other things in the community, whether it's a grocery store or not. We have our universal masking. We're checking temperatures. Our patients are being screened for COVID-19 before they come in. We opened up to visitors, but We're also limiting the amount of visitors as well. So we're providing a very safe environment for our patients. Many of the chronic diseases that we treat with obesity, whether it's obesity itself or its related diseases like diabetes, high blood pressure, high cholesterol, or any sleep apnea, these conditions are present long before we had the COVID-19 pandemic, and they will be present long after the COVID-19 pandemic. And so we feel a strong responsibility to continue that care all through the pandemic, although it's been in a little bit different ways at times. I'd like to introduce our next speaker, Dr. Khalid Abbed. He's the co-physician-in-chief for Hartford Healthcare Ayer Neuroscience Institute.
Thank you, Dr. Tishler. Good morning. Thank you for the opportunity to speak with you this morning. So COVID-19 has been a significant stressor on each and every one of us, individually as well as collectively. But as stressors often do, it teaches us lessons and opportunities to do things better. As we expand our footprint throughout the state of Connecticut, Hartford Healthcare and the Ayer Neuroscience Institute is expanding into Fairfield County to give patients in that county access to our world-renowned providers. But we're also doing it in a way that is novel. COVID-19 has shown us how fragile health is, how important it is. It really is the differentiator with regards to whether you're going to survive or not. Global pandemic or any healthcare concern. It also showed us how fragile life is and how it can be taken away quickly. It showed us how important access to healthcare is. And it put a magnifying glass on the disparity of access to healthcare in our society. As we grow, we need to remember that we are one body. We are one community. And if part of that community, part of that body is suffering, we all suffer. With that in mind, as we expand and we build new access points for patients to be treated, we are building community centers and wellness centers, not just points to go to when you are sick or points to go to when you have pain, but some place that you can go to even when you're not sick, even when you don't have pain, but just to improve your quality of life. Learn how to eat better, learn how to sleep better, learn how to move, exercise, not be sedentary, learn how to calm the mind, learn how to control emotions. All of those things make us human. It's not just the herniated disc and the leg pain. And as a surgeon, that's kind of what we were taught in school, anatomical structures, pathologic problems that we need to fix with surgery. And far too often we forget about the actual human attached to that spine and the issues it can cause with family and work and friends. And so as we develop within communities, we are understanding that we are that community. We are part of that community, and our role in that community is to allow people to live their best life, not just come in when they need us from a pain standpoint, but come in before that. We can help you with pretty much anything in your life. We are developing a center that, yes, will have surgical consultations, we'll have pain management, we'll have procedure rooms for injections and shots, we'll have physiatrists, physical therapists, all those things we will have. And we will have it in a way that is compassionate and empathetic and easily accessible. But what will differentiate us is we will also have the aspect of health and wellness for those who aren't sick or who don't have pain, but who know that they can live a little bit healthier, live a little bit better, maybe live a little bit happier. And so as part of our growth, we are developing, we are working with integrative medicine department, we are working with the rehab department, we are working with dietitians and nutritionists in behavioral sciences. We're working with all of our providers to put everything under one roof and to be comprehensive and integrated. And so if your problem is insomnia, we can help you with that. If your problem is weight loss, we can help you with that. And so that's our goal. We're piloting this in Westport in our new spine center, in our new spine and wellness center. But our goal is to extrapolate that and standardize that throughout the state at each and every one of our healthcare sites. All 7 of our hospitals and our offices in Mystic and Vernon and in Cheshire and in North Haven. And with telehealth and virtual consults, we can expand this past state lines. We can expand this throughout the states, throughout the country, throughout the world. And my hope and my expectation actually is that this will become the standard of care because health and wellness is the key. Preventative medicine is the key. Eating right, sleeping right, and exercising is the key. And if we can get people to do that, then there will be many less people who have problems who will need surgeries and those things. Of course, that won't go away and will be there for those who need it. But our hope is that we can help the community rise up and live their best lives. Thank you. Any questions? All right, Keith?
All right, any questions before we close? As they said, we continue to expand our capabilities. We continue to extend our appreciation for the opportunity to communicate this information to the masses. I think one of the initial commitment from this team was to ensure that this was done, and very quickly we established our call-in center, hotline, with that now serves not just Connecticut, not just Hartford, not just Connecticut, but a number of states still do call into this hotline in order to get the best updated information. So if there's no more questions or no questions.
Bridget from the Republican American. Could I just ask one question regarding the notation on the obesity risk factor? What is it about obesity that makes some people more prone to COVID-related serious problems?
This is Darren Tishler again. That's a great question. I wish we had that answer right now, but we know that obesity is related to a variety of other health issues, whether it's diabetes, high blood pressure, high cholesterol, sleep apnea. There's definitely difficulty breathing in severe forms of obesity. We're actually doing some research on that right now. We have a very robust registry of all of our patients from Hartford Healthcare across the system who have come in, and we have an IRB-approved protocol right now looking at this. So I hopefully within a few weeks we'll be able to report out on that data. It wouldn't be responsible for me to report out on data, but I don't have everything there yet. But I think we're going to have a better understanding pretty soon of some of the impacts that obesity has had. The other thing that we're seeing is that there's also this overlay between the populations that are being affected more from COVID-19. So we're seeing it definitely affecting our Black and our Hispanic populations at a higher rate. And at the same time, these are populations where obesity also has a much greater effect. So I think we're going to see something there. COVID-19 affects so many people, all races. It affects all ages, but there's definitely a disproportion that we see in certain racial groups as well as in certain populations.
Okay, we'll look for more then later. Thank you.
You're welcome. Any other questions? Thank you all for attending the briefing today.